Hello there, welcome to the last installations of putting Dr. G on the spot in the month of October, when we're focusing a lot of issues related to HPV. We've dealt with genital warts, cervical cancer and oropharyngeal cancer, and today we're going to deal with anal cancer. Anal cancer is well known to be associated with HPV. In fact, there are two subtypes of HPV. One is HPV 16 and 18. What is believed is that although somebody can actually get rid of the disease itself with a natural immunity, however, some people may not be able to get rid of it, and that will turn into genital wart and subsequently will cause changes in the cells, and the early precancerous changes may lead to cancers of the anus. So many people don't know that HPV in fact affect women a lot more than men, especially older women. We actually don't know why. However, we know that older women who are age 60 and above are more subjected to HPV infection in the anus and subsequently may progress to anal cancer. So contrary to common belief that anal cancer only happens in men having sex with men, in fact, the chances of men getting such cancer is about 3-fold less than a woman. So what exactly is causing anal cancer? The HPV transmissions during sexual activity or during contact may actually harbor itself on the anal verge, and then with the lower immune system or somebody who actually have higher prognostic risk factor such as smoking, the cells may change form and turn into cancerous form. In fact, it's observed in most high-income nations that anal cancer is creeping up by about 2% in women and 2.6% in men over the last decade. And so therefore, it is important for men, especially men, to actually build their immunity through vaccination. We know that the chances of men developing natural immunity from HPV 16 and 18 is as low as 3 to 8%. Therefore, with a bit of helping hand from the vaccination, their immunity can go up to as high as 97% of antibody being produced after exposure to the vaccine within 7 months. And the antibodies is sustained for more than 90% over a 10-year period. And if the study shows that, then we know nature is given a bit of a helping hand to boost men's response to contracting HPV, and that subsequently will reduce the risk of getting anal cancer, oropharyngeal cancer, genital wart, and also penile cancer in men. For following week, we are venturing into the month of November, and November we also focus on another form of cancer, which is predominantly male-related cancer. So next week we're going to talk about the diagnosis of prostate cancer and how do you know you've got prostate cancer. So if you're interested, stay tuned for next week's Putting Dr. G on the Spot.